There's a whole host of things in your back that can become painful. Most of the time when a patient calls in and they're concerned about back pain, they always think about the very worst things it could possibly be, like a tumor, a malignancy of some kind, which is incredibly rare. Most of the time, back pain is caused by worn out discs. There are also facet joints in the back where the two bones come together. Those facet joints can be painful. The bone itself occasionally can fracture, especially in older patients, and so we have compression fractures. So there's a lot of different structures in the back that can actually cause pain. Most of the back pain that occurs, though, is actually from muscular problems. So somebody goes out to the garden, does a little too much gardening, irritates the muscles in their low back, they get some low back muscle spasms, and when that happens, that takes about 6 or 8 weeks sometimes to settle down. So I think that's probably the most common thing, is just an overuse and some muscle injury from the overuse. Typically, we don't ask patients to consult a physician for at least 6 weeks after the back pain occurs, unless it's associated with other findings. Some of the red flags that worry us, that would want us to have somebody come in sooner, would be if there is any neurologic involvement. In other words, numbness, shooting pain down the leg, weakness in the leg, or if it's associated with a period of weight loss that's unintentional weight loss, or if it's associated with sort of a chronic, boring nighttime pain that just doesn't go away, and there's no history of a trauma or anything like that, then we want to see those patients a little bit sooner. Also, if a patient has a fever, chills, and we might be concerned about some type of an infection, we'd want to see that patient sooner. But absent those red flags, most back pain goes away all by itself with no treatment whatsoever. And so it's always good to let that your body heal itself. So I would say about a period of 6 weeks, with maybe some anti-inflammatories when appropriate, maybe some Tylenol, some simple things like that. And if the back pain persists for more than 6 weeks, then you should probably come in and be evaluated to find out why your back hurts. If surgery is indicated, and that means you've failed conservative treatment and you're having ongoing pain that's just intractable, or there's some neurologic involvement, then we typically start thinking about surgery. It's always important to treat it surgically before you let your leg or your foot or your arm become weak. Once there's weakness there, so it's very unpredictable about whether we'll get that strength back. So we don't want to let it go too long. So we'll evaluate and make sure we know when it's time for surgery. Then when it's time for surgery, the pros are, oftentimes the pain is dramatically improved right away. That's particularly true in neck surgery for patients that have disc herniations and radiculopathy, or pain that shoots down into the arm. It's also true of patients with disc herniations in the low back. In general, a low back surgery is a much bigger recovery than a neck surgery. And so, with a neck patient, we can oftentimes tell them, you'll wake up and probably will feel better immediately after surgery. Whereas with a back patient, we're going to give them some back pain from the surgery itself. But all the approaches now are minimally invasive. So the pros are that we can get them done quicker with much smaller incisions than we ever could before, which means a much shorter hospital stay. A lot of these procedures I actually do as an outpatient. So we either go home the day we do them or early the next morning after the surgery. Well, I would just reassure people and say, don't think that you have to live that way. Get into your primary care doctor, get some x-rays when appropriate, get referred on to a spinal specialist. That doesn't always mean spine surgery, which is still, I know, a scary thing for people. But there are a lot of conservative things that we do too, and we only operate when those conservative things fail. So my advice to patients who hurt is to get in, get seen, find out why you hurt. Don't be afraid of it. It's rarely something really severe. Most of the time it's something very common and simple and straightforward, and there's no reason to live in that much pain.